My name is Victoria Alexander, and I am the Older Adults Program Coordinator at Syntero. Today, I'd like to talk a little bit about how sleep affects our mood throughout the day and how we feel. As we know, the mind-body connection is very strong, and this is a classic example of part of our wellness. So our daily routines, including what we eat and what we drink, the medications we take, how we schedule our day, and how we choose to spend our evenings can significantly impact our quality of sleep. And usually, even just making a few slight adjustments can make the difference between a sound sleep or a restless night. So you might have heard the term sleep hygiene. And sleep hygiene is what we use to describe our healthy sleep habits and rituals that can help our ability to fall asleep and stay asleep. Cognitive behavioral therapy is certainly a big part of it. Cognitive behavioral therapy can help us address the thoughts and behaviors that prevent us from sleeping well sometimes. It does encompass different techniques for stress reduction, relaxation, and sleep schedules management. So if you're having difficulty with sleeping or staying asleep, or you want to improve your sleep, there are many things you can try to help reinforce healthy sleeping habits. If the problem starts to be a pattern, definitely consult your doctor, and you can see a sleep specialist for further evaluation and exploration and treatment of the sleeping issues. I'd like to share with you some helpful tips sometimes to encourage good, healthy sleep habits. One being, keep a consistent sleep schedule. Try to get up at the same time every day and go to bed at about the same time, even on weekends or during vacations. Don't go to bed unless you are sleepy. Make sure you go to bed when you're able to get at least 7 hours of sleep. If you go to bed and you don't fall asleep after about 20 minutes, do get out of bed, and by switching up your environment, that will help not make an association between getting maybe potentially frustrated with not falling asleep while you're still in bed. So if you leave the room, maybe you can read a book if you enjoy reading, listen to some calming music, maybe do a guided meditation, just something to kind of switch up the environment, because you don't want to, as I said, start getting frustrated by you're lying there and you're trying to fall asleep. So it can be a little paradoxical and work against you. Establishing a relaxing bedtime routine will help get you in the mind frame and get you ready for bed, and your body and your mind will associate, oh, these are the things I do before I go to sleep. I like to have a cup of mint tea. I like herbal tea before I go to sleep, something that does not have caffeine in it. And that's one of the cues that I think my body takes, like, oh, it's going to be bedtime here. Don't use your bed to do, research or work, anything that's not calming and associated with actually going to sleep. You should use your bed only for sleep and for sex. Make sure your bedroom is quiet and relaxing. Keep it at a comfortable and cool temperature. We've done a lot of research, and the research shows that we do sleep more soundly when the room is not very hot. So however you find it to be comfortable. Some folks like it a little colder than others. So it's up to you and your preference. You want to reduce the exposure to bright light in the evening before you go to bed, and that includes blue light. So turn off your cell phone and don't watch TV at least 30 minutes, preferably longer, before you go to sleep, because that blue light is very activating for your brain, and it can be hard to be quiet. It can be hard to get sleepy if you're looking at a blue screen. Avoid eating a large meal before bedtime. If you're hungry, go ahead and eat a light, healthy snack, but try not to eat a big meal right before going to bed. By exercising regularly in accordance to what you can do, that will help you get tired at night and sleep more soundly. And have a certain cutoff time for consuming caffeine in the late afternoon or evening. So that time is going to be different depending on how your body responds to caffeine. Also, avoid consuming alcohol before bedtime because that can disrupt your sleeping patterns also and reduce your overall fluid intake before bedtime. Insomnia is actually the most common sleep complaint that the average person has. And insomnia means that you have trouble falling asleep or staying asleep, even though you have the opportunity to actually get a full night of sleep. So the symptoms vary from person to person, and it can be either it's hard to fall asleep, or it's hard to stay asleep throughout the night, or it means that you're waking up too early in the morning. So this can mean a variety of different things. And about a third of adults at any given time are complaining of having insomnia. Of course, everyone has the occasional night of forced sleep due to life circumstances or what might be going on with us. That doesn't mean you have insomnia. We're talking about if this becomes a pattern and lasts for up to 3 months. If it goes beyond that, you will definitely want to consult with a sleep specialist and investigate a little closer as to what might be occurring. Chronic insomnia can last at least 3 times per week and last beyond 3 months, and about 10% of people have chronic insomnia. You really should invest in a good quality mattress and bedding since you do spend about a third of your life on it. So do what you can for that. One of the major causes of having a sleep disorder is certainly circumstantial stress in your life circumstances. There could be minor things going on, work or personal stress, maybe even more severe changes going on in your life, such as death of a loved one, divorce, or maybe job loss. Other sleep disorders can certainly make insomnia worse. Some people have restless leg syndrome, and this can make it to be hard to fall asleep. There are certainly also many physical illnesses that can bring on insomnia. If someone is experiencing pain or have limited mobility from medical problems, they might have a difficult time falling asleep or staying asleep. Also, insomnia due to medical conditions is more common in older adults because people tend to have more chronic health problems as they age. But we can certainly do things about it. So again, please do consult your physician if you're noticing this as an issue. In combination with therapy and taking care of yourself and using these bedtime routines, they can really make a big difference. There is a relationship between sleep and emotional and mental wellness. So insomnia is sometimes caused by a mental health disorder. And then oftentimes, if there is a clinical threshold diagnosis going on, insomnia can also be co-occurring. So depression is one of the most common mental illnesses in America, and certainly a frequent cause of insomnia. People with depression often find themselves having a hard time falling asleep or staying asleep. And also, difficulty falling asleep is common in people with anxiety disorders. Also, folks with a bipolar disorder diagnosis can also have sleep problems. Insomnia can be an unwanted side effect for many prescription or over-the-counter medications. Even common cold and allergy medications can make it difficult to fall asleep as one is adjusting to maybe a new antidepressant or medication to treat ADHD, blood pressure, or Parkinson's. It can have an effect on their sleeping pattern. Environmental factors is definitely a huge impact on sleeping. Being exposed to noise, light, or extreme temperatures will interfere with sleep. So again, set up your sleeping area to be comfortable and cozy for you. Sleep apnea is definitely a serious sleep disorder that you would want to have evaluated for if you suspect that you might have it. And it's when the airway becomes blocked and limits the amount of air that actually goes to your lungs. So a lot of times when someone has sleep apnea, if they do have a bed partner, they might say they are snoring or even making choking noises as they breathe. So because the brain and body is becoming oxygen deprived, this might happen anywhere from a few times a night or even several hundred times a night, depending on how severe the case is. So this is definitely a condition in which it's very treatable, but it does need to be evaluated. Someone might notice that during the day they might feel very fatigued, feeling unrefreshed, even though they thought they had a full night's sleep. And they might even be falling asleep during activities during the day. So long-term consequences of this can include high blood pressure, heart disease, stroke, diabetes, and depression. So getting evaluated for that can be very helpful. And there are many treatment options. There are some people that are called long sleepers, and they actually regularly sleep more than the average member of their age group. And they might find themselves ever since childhood that their nightly length of sleep actually tends to be 10 to 12 hours, but their sleep quality is still normal and of good quality. They just sleep longer than what most people need. Most people need about 7 to 8 hours. And that's not actually, it's not necessarily a bad thing. It's just their pattern is that they need more sleep. So sleep specialists right now are not considering that to be an issue. Again, there is a bi-directional relationship between depression and sleep issues. Poor sleep can contribute to the development of depression, and then having depression makes a person more likely to develop sleep issues. It can be a complex relationship and challenging to know which came first, but we do know that both co-occur. Insomnia is experienced in about 75% of adults with depression. And it's estimated, they're still looking into it and researching, but about 20% of people with depression might have obstructive sleep apnea, and 15% have hypersomnia. So if you can write a sleep diary for 2 weeks, you can track what changes you might be noticing, what you're observing in your sleep schedules, and this can be very helpful information to share with your provider and your physician. Sleep issues can also contribute to the development of depression through changes in the function of the neurotransmitter serotonin, and it can affect the body's stress system, disrupting the circadian rhythms and, again, increasing the risk of depression. Oftentimes, as folks get major depression treated and they're working on it, they often they report improved quality of their sleep. Counseling is a wonderful tool to help with issues in this regard, and exploring different medications can be helpful. We've also found that people that have been diagnosed with clinical levels of depression have decreased REM sleep latency and prolonged REM sleep periods earlier in the night than on average. So this can have an overall increase in the production of REM sleep, and they have more frequent rapid eye movements in REM than the average person. So that was really an interesting find.